let's talk about possibly one of the scariest topics I've covered this October month: bacterial drug resistance. Now, as you may know, the discovery of antibiotics was one of the most important recent discoveries because it allowed the treatment of many bacterial diseases that normally we would just have to basically give supportive therapy and hope the person doesn't die due to something like an ear infection. The first discovered antibiotic was penicillin, and that was discovered entirely by accident, but now we have a ton of other antibiotics that are good for treating different things, have different strengths, and all of that, to most effectively treat different types of bacterial illnesses, which is all well and good until we get to the point where these bacteria are becoming immune to these antibiotics. One of the easiest cases to talk about with this is MRSA, or methicillin-resistant Staphylococcus aureus. This is Staph aureus. If you've had a staph infection, it's probably been one of these guys or a relative of one of these guys, and usually they are pretty easy to treat. And a lot of the time, up until somewhat recently, they were treated with this guy, which is methicillin, a type of antibiotic. However, that was until they evolved resistance to the antibiotic that was most commonly used to treat them, thus resulting in methicillin resistance. This has caused this MRSA to become a superbug, or a type of bacteria that is immune to the most effective antibiotics. Now, this is a problem because MRSA is also the most commonly acquired hospital-acquired infection, meaning if you go to a hospital and leave with a sickness, it is almost always MRSA. Healthcare workers, so like nurses, doctors, surgeons, janitors, all of that, if you work in a hospital, it is almost definite that you will test positive for MRSA, and most of the time that is not an issue. However, it becomes an issue if you are somehow immune compromised. So if you're taking immunosuppressant drugs, if you are pregnant, if you have a chronic illness, or you have something like HIV or AIDS, that is when it becomes a problem, because when you have an already weakened immune system and you get infected by a superbug that is unresponsive to the most common and most effective blue screening antibiotics, fuck me. Y'all see, this is why there's so many breaks and clips in my videos, because if I talk for too long at once, I forget what I'm saying and I forget what words are. So if you become ill from MRSA, you will need a whole bunch of different antibiotics, some of which have nasty side effects. You may have to take multiple different antibiotics, and if you have an already weakened immune system, that is not good. While MRSA is the most common and most well-known superbug, there's a few different ones. Other superbugs include types of enterovirus, types of candida, types of gonorrhea, and types of tuberculosis, all of which are not good to have, and especially not good if you can't treat them, especially tuberculosis. And if, like me, you're a super fucking nerd, you've probably read John Green's book, Everything is Tuberculosis, and he's goddamn right. So how do bacteria develop drug resistance? Well, there's a couple different ways. Some of them are due to just random mutations, which helps them become more resistant to common antibiotics. Just kind of the regular type of evolution scaled up a little bit. If one bacteria has a mutation that makes them resistant to, say, penicillin, they survive being dosed with penicillin, and then they multiply, and all of their progeny also are resistant to penicillin, and on and on and on until you have a penicillin-resistant strain of bacteria. Another method is one thing that I've talked about a long time ago when I was deep in my medical microbiology class, is horizontal gene transfer. Horizontal gene transfer basically is where two different bacteria will basically just exchange genes, whether through plasmids, whether through a sex pilus. And so, if one bacteria has a penicillin resistance gene or other antibiotic resistance gene, they will transfer it over even to a entirely different species of bacteria thus giving that bacteria a brand new antibiotic resistance gene. Now this basically is just a race against time. We develop stronger and different antibiotics, the bacteria develop a stronger and different antibiotic resistance. It's just an arms race between us, the antibiotics, and the bacteria. This is just natural evolution and a pretty good case for why evolution exists. However, the people that don't believe in evolution also probably don't believe in bacteria. But it also can be aided, or at least the bacteria can be aided by a couple different things that people do. One of them, and this is one of a few major issues with the modern medical system, is that doctors tend to overprescribe antibiotics. Especially way back when antibiotics were first discovered, doctors would prescribe antibiotics for everything. Absolutely everything. And that became a problem because the more that antibiotics were prescribed, especially when the patient didn't need it, the more and faster that the bacteria developed resistance. Even for things where patients didn't necessarily need antibiotics, such as a surgery, they were prescribed antibiotics. And this has contributed a whole lot to the antibiotic resistance. Now, some places are establishing things to do that don't require this overprescription, such as after a surgery, keeping the patient quarantined in a sterile hospital room for a couple days to make sure that the area of surgery doesn't get infected, instead of just sending them home with a bunch of antibiotics. However, overprescription is still a major issue. Another contributor is people not following the instructions on the antibiotics. It is a problem with people being like, no, I don't need this, screw this, I'm not taking these, in which case they get an infection. Or, if they don't take the full course of antibiotics, they're like, okay, it's been 3 days, I don't need to take the full 7 days, I'm fine. And they do feel fine because the infection symptoms have started to subside, so they think that it worked, but they didn't kill off all of the bacteria causing the infection. They only killed off enough of it to stop experiencing symptoms. So, when they stopped taking the antibiotics, the survivors that were a little bit more resistant to the antibiotic, they start to multiply again, and these new spicy bacteria have the antibiotic resistance. So even if you go back to the original course of the antibiotics because they're like, oh shit, I'm feeling bad again, you're not going to get that much better because now these new bacteria have evolved resistance. Then you're going to have to go back to the hospital and be like, hey, this isn't getting better, what do? You lied to me, and the doctors are going to be like, did you take your full course of antibiotics? And you're going to be like, no, because I felt fine, and the doctors are going to be like, well, now they're resistant, now what? And finally, while this doesn't directly contribute to antibiotic resistance itself, anti-vaccination. If you don't vaccinate your kids are going to get infections, and they're probably going to die, and then you're going to need antibiotics, and maybe they'll get infected with something that has antibiotic resistance. Vaccinate your goddamn kids.